Hello there, everybody. It's Ken Pecoraro here with another edition of CPC Speaks podcast. And today I have two great guests. I have Ryan Cooperhouse, who's one of the managers here at CPC, and he's in charge of a great project working on, and also Julie Edwards, who is an advanced practice nurse here. And we're going to be talking about integration. It's one of those catchphrases you hear all the time, and people might wonder, what do you mean by integration? And it really is exactly what it sounds like. It's putting things together. So just a real quick history that kind of puts that in perspective is, if the farther back in time you go, there's less integration in the behavioral health field. In the old days, so to speak, there would be mental health treatment in one spot and addictions treatment in another, and then medical out in another spot. And now this movement towards integration, a good way to look at it is like one-stop shopping, as far as going to one place that's working on getting people their substance use needs, their mental health needs, and now their medical needs all in one spot. So that's where CPC has been headed, and it's really fascinating. It's definitely the future of behavioral healthcare. So these two guests here know a lot about some of the things we're doing on. So without further ado, let me tell you. Why don't we start with Ryan? Tell everybody about the project we got going on here.
Yeah, so the project we have is integrated system of care. It is integrating what we do here at CPC with primary care offices throughout Monmouth County. Just like Ken said, this is something that is relatively new, really trying to get everybody on board and breaking down the barriers and the stigma of, somebody has to see primary care for medical, somebody has to see a substance use counselor for substance use, and somebody has to see a mental health therapist for mental health. We're really trying to break down all those barriers and the stigma and, making it so everybody can kind of work together. And building relationships with primary care offices and getting out and pounding the pavement, talking to doctors, primary care offices, practice managers, letting them know we're out here, we're there to help them, and help do medical case management for them, for their clients who are here at CPC.
So for the average layperson just hearing about this, like, walk us through, what's it like? How does this serve a client?
Yeah, so think about it. If you have a client that comes here and maybe sees Julie for medication, and they have some chest pain, we send them to the primary care. Primary care says, hey, look, you got to go see a cardiologist, right? What's the likelihood of that person leaving primary care, following up with cardiologist, and then the paperwork and documentation and labs going back to primary care? It's slim, and that's what all the primary care doctors have been saying, is it's really difficult to get somebody to do that and to get the results back. So that's what we're doing, is creating these relationships with primary care and helping our clients sit down, schedule these appointments, provide transportation if we need to, and making sure that the paperwork, the labs, the documents are all getting back to primary care, that we have it, so the client doesn't have to go get blood work 3 times because we're not coordinating with each other.
And how does the behavioral health piece fit in there?
Yeah, I mean, think about it. If somebody might be anxious, right, and then they got to go see the primary care doctor, and the primary care doctor says, oh my God, I really need you to go see a cardiologist or a gastro doctor. For somebody who's anxious, that's going to be really difficult just to sit down and pick up the phone and make the call. So CPC does a great job of really, meeting the client where they're at and helping them with, their goals as well as what we're trying to help them accomplish.
Mm-hmm.
Nice.
And I think, we all know that the healthcare system is fairly fragmented. Like, each specialist lives in their own little world and deals with one specific problem, which there's lots of consequences to that, right? It's like a really high cost system. It's not like a great utilization of all our resources. It also is super overwhelming for patients, and care providers don't always get the information they're looking for, as we're describing. Like, each specialist is ordering their own labs and asking for different things. And it can end up falling on the patient as kind of like a full-time job to manage all their health care. So it ends up, being a system that's really difficult to navigate, and then increasing people's stress when they're already at a time in their life where they're probably having trouble managing their other things too.
So, and one of the best parts for us behavioral health people has been having the medical staff on board now. So what's it been? I'm curious. I know probably it's a good thing I'm asking you this while live, but so what's it like being a medical person? More of a, I mean, obviously you're behavioral health as well, but you're original orientation was training in medical. How is that? What's it like to be working in a center where focused so much on people with substance use and anxiety and depression and all those things?
I think it's really ideal and rewarding that we kind of do have this one-stop shop, and it really decreases barriers to care. Because people are ready to work at things at different rates. Like some people are ready to work on their depression before they're ready to work on their blood pressure, and some people are ready to work on their substance use disorder before they're ready to treat their Hep C. It's totally dependent on each person, and it's really nice to be a place, I think, where we can start wherever the person is at and help them develop their healthcare goals. Because oftentimes, like for example, let's say someone comes in and is really depressed and needs to start there. If we can treat that first and build a good rapport with them and help them build some confidence in their own like health literacy and their self-efficacy, then after a few months of progress, they might be totally ready to go follow up with an endocrinologist and manage their blood sugar better. So it's nice. It's kind of that like incremental care that we can provide and like walk through all those different progress steps with people slowly.
It's nice. So let's like come up with a scenario. So let's say I'm winging this here, people listening. So let's say my name is Enzarino. I don't know. Come up with a nice name, and I show up for treatment one day. I don't know if that's probably a horrible name to pick, but all right. So if this fictional person comes in, and I'm dabbling with some drugs, drinking a little bit. I'm anxious. I'm also depressed because I'm anxious. Living with anxiety is really tough, and I'm out of medicines for my psych meds. And also at the same time, I tell you, I haven't gotten my diabetes taken care of in 5 years, and I'm obese, and I have joint pain. So here I am sitting in your office, and what are you going to do for Enzarino?
I think my first question for Enzarino is what is most important to him. And I think in the back of my mind, I'd also be thinking about like what are the biggest risks for him, right? When someone comes in and they're like actively using heroin, my first concern is like their overdose risk. So we got to prioritize a little bit, but it's also really important to find out what he thinks is most important, because I think we can start from there. So if he wants to work on his alcohol use first, that's going to help his obesity and his diabetes and probably his mood as well. So maybe we could start with that and start chipping away, and then slowly start adding to the list.
So that makes a lot of sense. So you're going to deal with obviously safety issues first, and at the same, and also considering where's Enzarino's motivation?
Yeah.
What is he? Good. All right. And what about, so Ryan, let's say you got assigned into this.
Yeah.
What would you bring to the table?
I feel like almost on a daily basis, Julie's sending an email out like, hey, or walking across the hall, hey, Enzarino came in and Enzarino needs this specialist. Do you know of somebody in the area with this specialist, or needs a primary care doctor who is going to be open to working with him and all of his needs? So just from being out and creating those relationships, we have a list of people that we go to now.
So what would you do? You take him to the appointment?
Yeah. So Julie would obviously be our go-to person in terms of like introducing us to Enzarino, and then we would absolutely help him schedule this appointment, sit down with him, literally dial the phone with him, or even do a role play with him. This is how you call. These are the things that you need to have on hand, insurance information, all that stuff, and help him schedule it. If it was something that it was so debilitating for him, we've scheduled it for them with them being next to us so they can see what we're how to do it. And then driving him to the appointment if it's needed. We could absolutely take him, drive him to the appointment, make sure that he has anything that he needs to bring, information that Julie would want from the doctors we would bring, and we would go from there, and then we would just see where it takes us.
So yeah, and it's funny, people take for granted what it's like to call a doctor,
It's overwhelming.
It's overwhelming. It's overwhelming for just, when you're busy in life, and then you throw in mental health and using drugs. It's very, so to end on a positive note, 6 months down the line, so we provide this integrated model for Enzarino. What's it like for him in 6 months? So now we made our attempt to do an integrated approach to his addiction, his mental health, and his medical. So where do you envision him?
Yeah, well, I could tell you, somebody that we know, this person has basically, it's been 3 months of us being involved, and he's out doing this stuff on his own now, and we had to literally make the call together. Make sure he was going, make sure he was coming into appointments. So I would say for somebody like Enzarino, in 6 months, it's definitely doable for him to be going to these appointments, having his medical conditions under control, and the coordination from us as well as the doctor flowing back and forth. Yeah,
Okay,
absolutely.
so you got him going to his doctor. He's
Yeah.
feeling better. And what about you, Julie? What would you see from
I
your
mean,
end?
all the things we're talking about are chronic illnesses, so obviously he's not going to be cured of any of these things, but hopefully he has a lot more confidence in navigating healthcare and has built enough of like a support system, either here or maybe in his own social system, that he understands where to go when he has questions. Because of course, with all these chronic conditions, there's going to be continued questions. Maybe he's doing great in 3 months, but now he doesn't understand how his medications work together, or he's having a new symptom to come up with. So hopefully he has relationships with us where he can reach out to us and we can sort of guide him on how to advocate for himself. Or he's at the point now where ideally he has an amazing relationship with a primary care provider and us, so that he can go right to them and build on that relationship, because that's ultimately who's going to be managing his physical health for the rest of his life.
And the behavioral health stuff? What about that?
Yeah, I think same thing on that front. These are all chronic conditions, so we don't expect that anyone's going to be cured, but there's going to be ups and downs, and hopefully this person is engaged enough in treatment that they're getting a better quality of life, and that their mental health isn't interfering with their physical health anymore.
Nice. So hopefully some kind of program for him to get off the drugs.
Yeah.
Or at least manage and then the anxiety and everything.
Mm-hmm.
Great.
And hopefully living a much happier quality of life.
It really makes sense. It's great to work in a situation where the model makes sense. I'm sure like all three of us are in agreement on that.
Mm-hmm.
I think hopefully most, or if not everyone listening, would agree that the integration model it's so in line with just how we operate as people. You to go in one place and make sure that it's all because it is all interrelated, right? Your medical, these things don't exist in a vacuum. So, no, well, you guys are doing great. This is exciting stuff. So, appreciate your input and everything, and sharing with everybody.
Thanks for having us.
Thank you.
All right.